ChatGPT and GenAI tools have hit the mainstream. The chatter was everywhere, by almost everyone. We feel the discussion has been more philosophical than practical. We know enterprise technologists are using real AI to create efficiencies that result in real business outcomes. So, we created a show to talk to real practitioners about real-world active projects that are leveraging this exciting new technical advantage. Welcome to LiveAI.
Welcome back to LiveAI, the show that brings you practical enterprise AI use cases. Today we have Jason Conley, CTO at Envera Health, a company that helps transform the patient experience and simplify the care delivery process. Welcome to the show, Jason.
Hey, thanks, Tony, for having me on.
Yeah, really excited for the discussion this morning. We're seeing a ton of AI disruption in healthcare, and today's episode is just another example. So Jason, just to kick us off, please tell us the mission of Envera Health and your role.
Okay. So Envera Health's claim to fame is essentially digital front door. But the reality is we are a patient engagement company, right? In that, COVID exposed many issues in the healthcare, in healthcare. That's all there is to it, right? You couldn't get appointments to get vaccines. There was not enough beds for people. We all remember the news coming to us saying, hey, this is what we got to, tamper down the wave, if you will, essentially to make sure we have enough capacity in the system. So, but let's be honest, access to care can mean kind of a couple different things. One, enough clinicians to, of course, serve the need, but getting them in the door was a major issue that was exposed. So Envera was founded on this idea to essentially reduce friction in people getting the care they need. And that starts right with the engagement up front, right? So if I was characterizing Envera as just, our overarching mission is essentially to be a patient engagement company. But there's a lot more to that, all the data about all the interactions that we, provide service for in our health systems. And Envera originally started as a services company. We were in the middle of the pivot to a tech company. So essentially we always say human plus tech. Well, we were probably more like 90% tech, 90% human, 10% tech. Now we're essentially swinging the pendulum over the last few years, and, generative AI is paving the way for us to be able to do that. My role, I'm just the guy you blame when something goes wrong. Is what it's always say. And my CEO always goes, yeah, I blame him for everything. By the way, he doesn't blame me for anything, but it's an easy stick essentially to figure out. And then my teams do the amazing work. So essentially, I'm the guy you blame when it doesn't work, and my team's the guy are the folks who essentially make magic happen.
Awesome. Well, and so if we were to just dig into then this problem and how you're solving it, then, COVID did expose this inefficiencies of the system, especially if everyone needs to be remote. And then now we've gotten used to this mode of interaction, being able to pick up the phone or being able to use an app, being able to use video and get the things that you need, whether it's, food delivered or, we've completely changed our expectations of, from a consumer's perspective of how all interactions should occur. And if you think about what you're doing to be able to do that in a certain amount of time or to improve that situation, where now does your solution come in? And tell me a little bit more about what you guys are doing.
Essentially where our stack stands out now is that generative AI, it's 2024. You guys take a drink of your favorite beverage. When we say AI, it's my favorite drinking game, by the way. But the point is that our stack comes in that it's going to meet the patient where they're at, right? It's going to interact where they're at. You may say that's omnichannel. Okay, yes, there is an omnichannel component to it, but now it's bringing in natural language processing and generative AI to interact with patients in the way that they want to. So we all remember in 2017 and 2018, chatbots are going to save the world and save customer service and reduce costs. Guess what? Unless you're checking your bank account balance or getting tech support, nobody uses them. Healthcare is the perfect example. Healthcare happens over voice. Now, some of that's generational. We have an aging population, so they don't, you can't teach an old dog new tricks, right? And, if I ask my mom, she's like, well, I'll just pick up the phone and call them. I'm kind of like, oh, but, I'm a Gen Xer. So, I'm caught in the middle, if you will, the sandwich generation. And this may change over time with, Zoomers and millennials, but if you look at the demographics of this country, it's going to continue to happen over voice. So that's where our tech stack comes in. We have AI, virtual assistants, whatever term you want to use. Really, it's conversational AI is the way I would classify it, but essentially virtual agents that are built for specific workflows is the best way to say it. And one of the key points of this is when we, engage with the health system, right? When we walk in the door, I hear all the time, I don't even know, I have 100,000 calls. What happens in my environment, right? And I go, I can tell you if you'll give me the calls. So I don't know if Tony, if your audience is aware, HIPAA, you have to screen record every call that happens, which, it's like you always get the message, this call has been recorded for training purposes. Guess what? It's also been recorded for HIPAA compliance reasons as well when it's a healthcare related call. But that's a great data point. Also, there's the whole premise of audit. Did somebody do the right thing? Was the clinical order correct, et cetera, et cetera. But there's also this, okay, what workflows are essentially the opportune points for us to look at automation or partial automation is essentially the way we approach it. So I'm already collecting all this data. Every health system's already collecting all this data, right? And, what do we remember in like 2010, everybody said, oh, business intelligence, we're going to start making meaning out of all the data that we have. Have we? Some organizations have, some haven't. And the ones that have probably, honestly, have set themselves apart and excelled in their market. But let's just be honest, healthcare is behind. It's always behind. Like, we steal facts, and it's one of those areas where, guess what? You're sitting on this data. Let's actually take and use it to figure out how we can better serve our patients and better use our resources as well.
So if you were then to get a little more into the details, what specifically does your solution do now that you have all this data at your disposal?
Sure. So, it's human plus tech, right? I would love to tell you it's just all tech. It's not. Trust me, our ownership would love for it to be all tech because, the margin profile associated with the tech company versus services company. But Envera prides itself on, if you look at the market space, sorry, I'm getting a little off topic here for you, but essentially if you look at the market space, there's these tech players over here that provide a solution, and some of those are even, big telephony, UCaaS, CX companies. There's service providers over here. Nobody takes and puts the two together. And that's where we excel, essentially, in that we actually can build a solution for you based upon your needs and, not to snowflake everything, because underneath the surface, it's completely scalable. That's not so much the issue. It's literally that we take and put these together and, because every health system is different, right? I mean, how many times have you ever called a health system and it's like, well, why isn't the call tree the same between this and this and this and this? And it's just,
oh yeah.
So, but technology's gotten to the point now where we can customize those needs, but yet still take the efficiencies associated with automation and, essentially what I consider workflow enhancements that technology can give us. So back to the solution. Healthcare still happens over voice, right? So we have virtual agents that'll pick up the call, figure out exactly what you need and get you to the right place, right? We've all called and went, press 9 for billing. It's like after you listen to 9 options, you're going, oh my gosh, what was 7 again? It's like, I don't remember the option I want, right? And natural language processing and generative AI backed by LLMs, give us the capability to be like, you just can interact naturally, right? Like literally some of the verbiage we put with our virtual agents is talk naturally, right? And of course, virtual agents, in their infancy, probably 5 years ago, you'd have to say the exact utterance that they were looking for, right? It'd be like, billing. We've all like screamed into our phones essentially.
Or put a person on.
Yeah, representative. But guess what? The technology has improved to the point now where you can literally just say, I need to schedule an appointment. I need to reschedule my appointment. I need to confirm my appointment. And by the way, our tech stack also has an SMS component to it as well. So you can interact in that way too. It is truly omni-channel. We do have chat that we expose as well. Although I'll be honest with you, almost nobody uses chat. It's pretty amazing. It's either SMS or voice is what we find that everybody wants in healthcare. But we'll see some uptick in chat. I do believe as demographics change in this country. So the solution interacts with you and then figures out essentially where you need to go. And it's really underneath the covers a series of virtual agents that have been built for various purposes. It's modular. I'm not going to use the term microservices, but that's kind of the methodology that's been used to approach. And then our entire stack's built in the public cloud. So how many .ai companies have we all been called by these days where it's like, .ai this, I've actually kicked the tires on some of these solutions. They have a scalability problem. That's what I always find with them. And we've built our solution completely on the public cloud to leverage public cloud services so we can scale up and down completely as needed. And then that gives us complete predictability on the operational costs as well. As a service provider, guess what? Those interactions drive our revenue, but they also drive our costs. We got to be very prescriptive. So it's an easy correlation. It's actually simplified our model because I like to say technology is simple and humans are complex. So if I have human agents that are doing these interactions, love them. We hired them because of their empathy, right? We're never going to cut the human out of this, out of this company. But the reality is that they're unpredictable, right? You get somebody on the phone, they may talk to you for 15 minutes, right? And guess what? That's clogging up the queues and somebody else is waiting, so it's this idea of automate the easy, low-hanging fruit to essentially reduce the friction on the more complex situations when people need to interact with a human, because we still want that empathy for that interaction.
And what results have you seen with this type of approach of a smarter virtual agent in the triage or the ingestion of the phone calls?
So the ingestion part's actually a different part. Let me get to that in a minute. It's actually
okay.
It's like you get it along for the ride, but also it's a tool that you can use up front to figure out exactly what you want to automate. So it's essentially the way it works is we automate things if you look at there's a couple different things here. If you look at the types of calls, so have you ever heard of the idea of like an intent or disposition when somebody calls in?
Sure.
Okay. So healthcare today, essentially they put a disposition in by a human that essentially would be like somebody called to schedule appointments, somebody called for their med refill or whatever the reason might be. The reality is there's actually multiple reasons people call. and call analytics give us the capability to actually break that down and dissect what's going on in the call instead of just, they called to schedule an appointment. Yeah, but what happened in those 7 minutes? Was there any issues? And then there's also some agent performance as well that we can glean from this. Or do we have, frankly, upset patients? And why are they upset, right? So that's all the data we can get to. So as far as the results, we've seen we can deflect. I hate to use that term. It sounds kind of negative. But we call the term we're sticking with is automated resolution. Okay. So somebody's problem was solved, just happened to be in an automated fashion. So this is simple things. Like it's kind of crazy when you start looking at like I use the round number of 100,000 calls. Somewhere between 20 to 30% of them are ripe opportunities for automation. They want to know office hours. I mean, all the millennials and Zoomers are cringing that listen to this going, why wouldn't you just go to the website and look this up? Back to the demographics. Somebody's calling because they want to talk to a person to get their question answered or something. That's obviously where, conversational AI, generative AI, and natural language processing in its current iteration can solve this issue. So we are fully automating anywhere from 8 to 20%, depending upon the actual health system and, just specialty that we're talking about. So Envera services PCP, pediatrics, geriatrics, we call it Center for Aging, or just varies, right? Dermatology, OBGYN, you just name it. We hit it all. essentially, all the different specialists. All those different specialists have different nuances. I know this sounds crazy. You're like, you're in the contact center. Isn't it the same thing? Somebody's answering a call. No, if you have oncology, it's a completely different workflow. You need to white glove those patients. They are going through the worst parts of their lives, is essentially. You need to make sure that experience is completely white glove so they have the best experience that's possible. And people with kids, guess what? You got to make their lives easy. They have screaming kids in the background. They're already stressed. You got to make sure that, you figure out ways. So if you dissected all the call flows that we build for our clients, we've really dialed them in to essentially address some of those nuances. At the end of the day, it's still, contact center, but it's so much more from a data perspective that we give insights. Because one of the things contact centers, how can I say this? Most people view them as operational overhead. You should view them as a strategic enabler. I use that term because they should drive your revenue. Because somebody can go get healthcare somewhere else.
Sure.
They can go get healthcare somewhere else. They have a bad experience. I'm going to go deal with somebody else who'll take better care of me. That's all there is to it. So you need to review. And then also there's this whole thing of, let me talk through the call analytics part again, because you did ask that question. I don't want to ignore that question. So what we like to do is, I'll be honest with you. When I say literally, I've had CEOs tell me they have 100,000 calls and they don't know what's going on in them. I've heard this a couple times, more than once. And I go, okay, give me 1,000 of them. Give me 10,000 of them. I'll go analyze them and I'll tell you what we should automate and what we shouldn't automate. Right. And then also sometimes they don't have the data. Let me rephrase that. They have the data, but they don't have it in a fashion that they can give it to us. They're HIPAA compliant. I'm not trying to rat anybody out here. But,
Sure.
But essentially they don't have the data readily. I'm like, okay, give us a month and we'll record them all and analyze them and come back to you with recommendations, because people don't have unlimited resources. And it's going to be some of this we've seen, we serve 30 health systems nationwide, so, and as we grow, we'll see more examples, but every once in a while it's like, why do you have so many med refill calls? We should automate the med refills, for you. We shouldn't be wasting valuable agent time. And frankly, somebody waiting on, in a queue, essentially to just get that answer when they could just interact with with an AI and be off the phone in 2 minutes. So, that's kind of us stitched together. And then also our platform does inline natural language processing, meaning that, it'll actually provide recommendations to the agent to reduce errors too. Tony,
in real time.
That's right. So how many times you called your doctor's office or been in your doctor's office and somebody's looking at a sticky note going, yeah, Dr. Smith doesn't take new patients on Wednesdays, So back to the whole healthcare being behind the times. EHRs, great. Finally got their digital, health records for everybody, or at least I hope everybody. It's 90+% now, in the high 90s. So we're getting there. But guess what's not in the EHR? All these nuances around the practices and the clinicians. Guess what? What I just mentioned about, Dr. Smith doesn't take new patients on Wednesday mornings, nowhere. It's literally nowhere in there. He has appointments and he has appointment types that are defined in the EHR. There's literally no other guidance. So one of the things we do is we actually develop verbose guidelines, take it out of the sticky notes, centralize it, standardize it, and then tag all the information in there. So literally the AI will listen to the call and be like, they're calling for the fax number for OBGYN, which hopefully an AI would answer. But if they still make it to an agent, they scream representative. It actually is going to provide a real time. Here it is. Click. Guess what? That reduces the handle time, reduces the stress on the agent, and then also, reduces errors too, right? Reduces training. So there's it's multifaceted in that AI can, help us automate the front end, can also help and assist the human. This is where human plus tech starts getting blurred, is the best way I would say it. And then on the back end, I get to analyze all the data to essentially say, am I being successful? Am I not being successful? And is there actually opportunities for improvement that I can make. And then essentially we like producing a scorecard back to our clients to go, okay, we've analyzed this. This is where we should automate. Because at the end of the day, we consider ourselves the experts in the room from a clinical workflow and from a contact center standpoint. We still want their buy-in. The last thing you want to do in this day and age, talking about, access to care being an issue, guess what? We have a real problem with the number of clinicians that are walking through those doors, and then clinician burnout too. So the last thing you want to do is upset your clinicians, but you also want to make sure they're used efficiently. So I'm going to ask you a question, Tony. What's the greatest sin in healthcare?
That's a complicated question. I would say, to me, this may not be the answer you're looking for. The greatest sin in healthcare today is that we focus on symptoms and not the root cause.
Your answer is very good, right? I'm on the front door here in the digital front door patient engagement side of the house. So the sin for me is a clinician who has an appointment on their calendar, it has white space on their calendar because somebody is waiting 3 months for that procedure or that appointment. Is the way I view it, and I would hope that everybody in Envera views it, right? So this whole idea of like care navigation, essentially, it's like, okay, guess what? People are complex, technology is easy, right? Back to that statement. People don't change. Their historical behavior essentially is a predictor of future behavior, right? So one of the things that we also capture about patients is, frankly, do they show up for their appointments, right? Because the whole premise, if you show up for your appointments, you take your meds, you stay out of the hospital, especially when you get, older in life, and that reduces healthcare costs, but also, frankly, leads to better quality of life, right? So one of the key things is let's make sure that Tony gets in the door and gets his care that he needs or gets his routine appointment so we head off some major issue downstream that might potentially happen. So the worst thing is having, let's just say, a not modern tech stack that enables your engagement. And Tony's like, well, I don't remember if it's tomorrow or next week when this appointment is. I guess it's next week, right? And you miss your appointment, and a clinician who's collecting a salary, right? Let's get back to the healthcare cost part of this. The clinician's still sitting there being paid, and 30 minutes goes underserved. So there's a lot of parts here to break down. One, somebody else could have used that appointment, would have been happy to have that appointment, and maybe they have a health issue that would have been, circumvented by, or at least the outcome would have been better if they got in the door faster. One. Two, you're now increasing healthcare costs because your revenue went down. This is back to the health system, essentially going, my revenue went down, but I paid that clinician to sit there for half an hour, right? And then 3, what about Tony? Tony didn't show up for his appointment, so what's his outcome, right? So we have this premise of a personalized engagement model, right? And, I would be lying if every one of our customers give this level of integration and data. But if we have the data, I can tell you that, hey, Tony's, he's not going to show up unless we remind him right up until the day of. So I'm going to dial up your engagement to meet, to essentially work towards you. Whereas, let's just say Bob over here. Bob's great. I need to send you one SMS reminder. You're going to click yes, and you're going to show up right on time for your appointment, right? Guess what? Lowers your costs. I know we're talking about pennies here, but we have, millions upon millions of people that we're essentially servicing. Still drives up healthcare costs, right? And we could argue this is a whole different episode to talk about what the greatest challenge in this country is, but being in healthcare, and I'm married to a nurse, by the way, so I know way too much about healthcare at this point. I got the number one end user in my house to tell me when things don't work. But essentially, guess what? Healthcare costs go up every year. It's it's just anything we can do to curtail that, not to get in the whole, big pharma, big healthcare insurance providers. Operationally, let's make this as streamlined as possible, and then also kick up the patient experience as well, and then also reduce stress on everybody who's in the system as well. That's what essentially we're talking about. All these pieces and parts stacked up all together will frankly drive more revenue for the health system, reduce, burnout on clinicians and operational staff like call center agents. And then one thing I also didn't talk about, guess what? We centralize these operations, right? How many times is it you go into the office and they're going, oh, hold on a minute, the phone's ringing, And it's like, well, that's not a great experience. So we centralize that, take that burden off of them, but we also keep the lines of communication open with them so we can message them, if there's something that comes up. And then some of the other things we also do is, guess what? If we get the inevitable white space on that, on a clinician's book, we also can then action upon that and drive. And it's like, hey, guess what? We see somebody else has an appointment a week out or 2 weeks out. We work with them kind of on the business rules. And it's like, hey, let's actually fill this appointment for tomorrow that was just canceled so we can make sure that white space doesn't show up there. So, back to the whole value prop.
Hey, Jason, let's dive into a couple of things there because you've covered a lot of ground, and I've got some questions that I think really around more the complications of delivering AI-related solutions in a healthcare environment. Because if you think about kind of like this concept of do no harm or introducing bias and those kinds of things, and we talked about there being AI agents on the front end, and then AI agents assisting, and then also how you're leveraging automation and other kinds of things to go make, appointment decisions and those types of things. Walk me through how you think about, developing an AI agent that is interacting with a patient. How do you think about the questions that it should not answer? Or if, because we mentioned earlier, they could take the conversation in any direction they want, whatever mood they happen to be in, what they want to talk about. How do you think about the safety aspect of where your AI agent assists, understands what not to answer, how to direct people back into like a safe lane? And then how does that, how do you address those ramifications when you think through like the development cycle or, the product cycles of what you guys are trying to deliver?
Sure. So first off, you got to understand the risk that you're associated with what type of interactions you're talking about. So like in our case, guess what? Somebody says anything about like symptoms or essentially the model has been trained to essentially say, if anybody says like shortness of breath or symptoms or I got a cough, whatever, it literally goes, okay, there's logic built into it to say, okay, I can't help you with your symptoms. I'm not going to be able to diagnose the issue, but I can help you get to a person who can connect you with the right person, right? So essentially we built the guardrails in that, you don't want it. We all talk.
It's not trying to diagnose somebody in real time over the phone.
Absolutely not. And then to your point also, the human element never goes away, meaning that I think that AI, and this is not Envera's, essentially area, but the point is that if you go look it up, I think there's a study I saw where is like AI is 99.2%, accurate. I forget the exact, on doing a diagnosis. And it's like, that's great. Is that good enough for human life? I'll pause when I say that, right? To your point of how do you make sure AI is not ready to be just left alone to do what I consider life-facing decisions, meaning that it's a key point. It's meant for augmentation, right? It's meant to automate things that, frankly, have a lower risk profile, is the way I would say it. And trust me, I've seen all the YouTubes and all the videos and the LinkedIn posts about we have virtual agents that replace nurses. No, we're not there, guys. We're just not. I do think, though, that we are ready to embrace augmentation to reduce the load on our clinicians. And also, guess what? We do automated quality assurance as well. And I found errors on what the humans have graded. So like, it's like, oh, is this a HIPAA compliant call? Guess what? The machine gets it right. They know exactly what you say. Whereas a human might be like, click, click, essentially. So the machines give us a chance to actually bump up the essentially reliability is the best way I would say it. It still needs that human governor is what I see. So even though I've automated, essentially automated, fully automated, resolution to these interactions in our case, guess what? I still collect all the metrics around every one of those interactions, have all the speech to text and all that, and I'm on all the data. So literally, I know I can essentially we essentially have analytics to essentially go, okay, there was an issue in this interaction, right? This actually was failed. It was not recognized. We have all of that feedback, right? And that's also part of the training the model too. Essentially, we ran, I'm going to guess probably about 100,000 simulations through our model to essentially get to the point where, okay, let's go, right? But it keeps getting better. Our virtual agents keep getting better the more they interact, is what you'll find out.
And when you say like built your own model, you built your own model, or were you customizing another model? I guess kind of walk us through like what that means.
Okay, so I don't care to say it. We are a public cloud AWS shop, and what we've done is we've chose a model. I don't care to say what it is, Anthropic, which might sound a little bit. Most people are using Llama and ChatGPT. We actually went Claude. Anthropic, and we actually just did an upgrade from 3.0 to 3.5, and it went pretty much flawlessly. So everybody's like, oof, what's going to happen when I change this or upgrade this?
Sure.
No, it worked very well. And just to get underneath the hood here, we use a vector database to correlate everything I just talked about as far as like guidelines and nuances and all these essentially all these, something that's not prescriptive as far as like logic that you can just build a decision tree off of. And that's a perfect use case for an LLM. And then also we have a large use of RAG as well for various data sources. So it's Claude at its core that's been trained for our needs. So it's private from a data standpoint.
When you look to like the model changes, so you just brought that up, you started with 3, went to 3.5, and obviously like they've got different variants of their models and stuff like that as well. How do you approach that? I mean, I think there is some mystery out there of how are people handling version control and the ramifications because there seems to be quite a difference, maybe even like the same models, week over week. How do you think about monitoring for accuracy continuously, and what the ramifications might be even for like a major update like that?
So obviously tried and true dev QA before you release certain things, right? Then we actually use AI to essentially test AI. you gotta love that because we don't have an army of humans to sit around and interact with it to essentially test. Then we digest all the data and make sure that the before and after results map essentially. But you are right in that, the models do kind of change a little bit over time. So we collect, I wish I knew the exact number off my head, but we collect literally hundreds of data points about each of the interactions. So I can immediately like zero in and be like, why is the timing on this one changed? Does that make sense? Like literally it's like, what's going on here? What are the outliers essentially? And then so I talked about automated QA. We still have QA people because the humans are not going away. They're just automated to be much more efficient. So we'll dig in and actually go listen to the interaction and be like, oh, well, the model got confused. Or you actually go listen to it and go, actually, I couldn't understand it, right? Even though it did the speech to text, you're kind of like, okay, no, it just literally, I mean, let's be honest. We're a very large country, right? I've got a good solid accent myself. So, but the reality is that it does a really good job, but there's just certain things that current natural language processing can't overcome. And then, also audio issues. Cell phones, bad rural areas, guess what? You're going to have some issues. There's just no way around it. I would love to tell you that there's a magic bullet for it, but there's just not. But back to your original question, we collect data about every interaction, like literally every interaction that we service. And immediately we bubble up the outliers and analyze what's going on and use that as inputs. So like every day we essentially go, hey, did you think about this verbiage that would actually address this need? And then we're just constantly, adding that into the data set to be like, okay, this is an accepted phrase to do this, because people are complex, technology is easy.
Hey, Jason, I want to be sensitive to your time, and I know that we're coming up on it. Is there any, whether it's last advice that you have for people out there based upon like what you're seeing from how you guys are very admirably attacking these key problems in healthcare, or maybe just a quick peek into the back end of how you guys look at the data and the kinds of difference that you believe that you're making?
Sure. Let me show you something, Tony. I'm of a mindset that data should guide us on everything. Actually, when I joined Envera, and David Serena, our CEO, can say this, I stood up in a town hall, virtually, by the way, and I went, okay, everybody needs to ask themselves, if you don't have a piece of data that backs up what you're doing, you should ask yourself why you're doing it. And that's a little odd for a CTO to like just step out there in front of like literally everybody and go, seriously, if you don't have a piece of data that backs up what you're doing, why are you doing it? And that's essentially what we're talking about here, right? Not only is generative AI perfect, solution for automation, the reality is still, what does the data tell us about how successful it is and what it can help us with? So I'm going to share my screen if you're okay with that.
Yeah, I'd love to see. We were just, while you're pulling that up, we were just at our Evolve conference, and I was talking about the same thing, like without having metrics to prove or some quantitative way to look at the difference that you're making, and then all you're left with is just feelings.
Right.
We don't have a chief feelings officer. I'm assuming you guys don't as well. And many organizations, need to find, where's the proof? How are you guiding these decisions? Data-driven organization obviously is, data-driven decisions, a big theme over the last 5 to 10 years. So I would love to see where you guys have taken it.
So back to what happens in these interactions, and the majority of them are calls, just like we talked about. What's going on in them and what's essentially the patterns, right? Back to the data drives what's going on. So we can dissect a call for everything that's going on, not only the issues, the actions, essentially all the outcomes, but we can also drill into all the different reasons people are calling in to interact. And you may say, well, they're calling in to schedule appointments or get med refills. Okay, that's great, but essentially, why? And then, of course, what's going on with their experience based upon that. So, get the right one here for you. This is a key chart right here. Do they have a positive experience based on what they're calling in for or not? Right? That's a really key thing. So it's like unresolved issues. Okay. It's interesting. They had a positive customer sentiment. That's just kind of interesting in of itself. But really, you need to focus on the negatives. What's driving the negatives so you can frankly level this up? And back to this whole point of, is our AI solutions been successful or not? Guess what? Patients will tell us. We're going to know pretty quickly if it's failing or not. And then I love this chart right here on the right side that I've got my mouse over, is literally, this is just a word cloud of things that are uttered in calls. And guess what? The larger it is, I mean, we've all seen word clouds, but the larger it is, guess what? Waitlist added. That's not one you want to see. That means that you have a throughput problem in your health system. So how do you address it? Do you introduce things like more telemedicine appointments? Do you look at, part-time clinicians to help address that needs? Like the contact center is the lifeblood of the health system, even though most people view it as a, overhead and, I got to call my into the contact center and go through the phone tree. Guess what? Those days are over. AI can interact in a human-like fashion, figure out where you need to go in an intelligent fashion. And then we have all the data essentially to drive where, frankly, the bottlenecks and the issues are in your patient engagement experience.
Yeah, I love it. And Jason, I love what you and Envera Health are doing to go address these problems. I think that's, any pursuit in healthcare to improve the way that we deliver care, the way we address big problems like burnouts, the way that we bring the kind of care and the kind of experiences that patients need and get them closer to something that becomes a true utopia as we think about the future of healthcare is something that we're all deeply, deeply passionate about at Trace3. So really appreciate you having on the show today, sharing a little bit of what you guys are doing. And well, hold on a second. I was getting let me do that again. Jason, really appreciate having you on the show today, sharing a lot about what Envera Health is doing. I think it's really admirable how you guys are attacking these key problems in healthcare, and I wish you the best of luck in the future.
Okay. Thanks for having me on, Tony, and look forward to potential future collaborations.
You've been listening to LiveAI. We hope you've enjoyed the conversation. This episode is sponsored by Trace3. To learn more about why you should connect with them, about your enterprise practical AI use case, visit them at trace3.com or look for them on LinkedIn. Thanks for listening.